Internal examination. This is routinely performed when assessing the progress of labor. Introduce yourself to the patient and explain the procedure. Place the patient in a dorsal lithotomy position. Demonstrate asepsis during the whole procedure. Put on examining gloves and apply KY jelly. Extend the index and middle fingers and flex the ring and little finger. The thumb should be pointing up. Insert the index and middle fingers of the examining hand carefully into the vagina. Estimate the average diameter of the cervical opening by sweeping the examining finger from the margin of the cervical opening on one side to that on the opposite side. The diameter traversed is estimated in centimeters. The cervix is said to be dilated fully when the diameter measures 10 centimeters. The degree of cervical effacement is usually expressed in terms of the length of the cervical canal compared with that of an uneffaced cervix. When the length of the cervix is reduced by half, it is 50% effaced. When the cervix becomes as thin as the adjacent lower uterine segment, it is completely or 100% effaced. The position of the cervix is determined by the relationship of the cervical os to the fetal head and is categorized as posterior, mid-position, or anterior. The consistency of the cervix is determined as soft, firm, or intermediate between the two. Determine the state of the membranes, whether intact or ruptured. The presenting part is palpated and differentiation of the vertex, face, and breech is accomplished. If the vertex is presenting, the fingers are directed posteriorly and then swept forward over the fetal head toward the symphysis pubis. The linear course of the sagittal suture is delineated. The positions of the two fontanelles are ascertained. The fingers are passed to the most anterior extension of the sagittal suture and the fontanelle is examined and identified. Then with a sweeping motion, the fingers pass along the suture to the other end of the head until the other fontanelle is felt and differentiated. Identify the triangular shape posterior fontanelle and the diamond shape anterior. The station or the extent to which the presenting part has descended into the pelvis can also be established. Determine the location of the lowermost portion of the fetal head in relation to the ischial spines. Document and explain the findings to the patient. Inform her what to expect after the procedure. Ask patient for any questions or clarifications.